the number of vaginal examinations that doctors have done, and then the number of vaginas they've seen, and then you think your vagina is attractive or is going to satisfy someone.
No, if it is wrong, it is wrong.
Someone actually
He's asking if you want to report someone. No, yes, if
there's no expiry date for crime.
yes, so if she feels that a doctor has harassed her and she has to come out, then we all agree. Don't you support that?
Oh, yeah.
Yes, we support it.
Hi guys, welcome back to my YouTube channel. If you are new here, my name is Belinda. If you're a family member, thank you so much for clicking on this video. So as you can see, today is quite different. I have here my colleagues and friends with me. We are going to dissect something that we've been seeing on the timeline on Twitter recently. And so without wasting much time, let's get right into the video. Woo! So I have here with me Ajua Jamra. She has a YouTube channel, so do well to subscribe. This Stacy and Emmanuel and Kojo Bewa.
Mr. Kojo.
Okay, so Emmanuel and Stacy to have a YouTube channel, so do well to subscribe to our YouTube channel. Yes. So there's this girl on Twitter that came to tweet something about doctors, a whole lot of things. So I just want us as medical students to analyze the situation or give our thoughts on the whole situation. The person is I am Nunya. Yeah. So she came to tweet something, but before that there was a skin white. This is what he came to tweet, and he says that does it ever occur to you the number of people that would have still been alive if we had a better emergency health response system and a better healthcare system overall? Many have died untimely death. Honestly, I side with Eskin on this tweet because I feel like Ghana, we can do better with our emergency health systems, because I have seen some before. People have died certain death they shouldn't have because of lack of certain equipment or the unavailability of certain crucial equipment at the A&E. So I'd like to know what Stacey thinks about this tweet.
I think he's right, because I spent quite a long time at the A&E during internal medicine, and you got so many people coming in and you just stabilize them and they'll be fine, or you try and then they won't be fine. You see, the doctors, they're just managing. Literally, that's what they're doing, managing with whatever resources they have. It's literally just experience that's carrying the accidents and emergency, not what we have, because we don't have anything.
So Kojo, what do you also think about this tweet?
Okay, so these people are medical students. I am not. So I want to be sure that you know that I'm coming from a non-biased standpoint. They may. But I think that with regards to the system, as the tweet said, then I am very likely to side with a guy on a lot of fronts. Let me give you an example. About 2 weeks or 3 weeks ago, my father's elder brother died in a hospital. And then what happened was, when we realized that his SpO2, doctors, please, you explain that to them, was very low, we needed a ventilator for this patient. Initially, they were told that there's no ventilator, so the patient had to travel from the place to Accra. Unfortunately, we realized that it won't be very helpful because the patient is likely to die on its way. So then the patient was on oxygen until a doctor came to tell us that, oh, there's a ventilator that's not working properly. So if we will sign an undertaking, they will put the patient on that, and that the ventilator is better than nothing at all. So eventually we have to put my dad's elder brother on it, and less than 24 hours, the ventilator stopped working and he has to die. I mean, sad story. So this is typically targeting how our systems are not working. In the whole hospital where this incident happened, they said they have 4 ventilators, 2 were working and they were on a patient. One was a sacra, and the other one was 50% working, 50% not working. And that's what, unfortunately, my dad's brother had to get. So yeah, if the systems are in place, if things are working well, I don't think some of these deaths will happen. The system is not just working.
This was Nunez's reply to Erskine's tweet. She says that our life expectancy has been decreasing since the early 80s, early 90s. Has it? Well, we'll see. We have more hospital and medical technology, but people we call doctors and nurses are bottom of the barrel quality. So she said they basically went to school to pass exams for the prestige and enjoy public sector employment. Personally, she thinks that doctors need 2 extra years of training to become the finished product. That is 6 years of schooling, 2 years of on-the-job training, housemanship, and then 2 extra years, making it 10 years in total of training. Well, Imano, what do you think about it?
I don't know whether I should start by laughing or I should start by crying because 10 years in medical school will be something else. And actually, to think of the fact that Nuna is a data scientist, that's what she said, right? A data scientist who is telling us that life expectancy has been decreasing. This is quite worrying, you understand? Because if you look at the statistics on the web, you understand, you get to know that it's rather getting better. At least times have changed. The health sector is improving somewhere in this third country, but it's not the best. And I know the doctors in this part of the country are doing their best. So to tell me that they have to school extra 3 years to get to 10 years, this is something I think none of the medical students will agree to. And I believe the process is unending. It's just about we learn even on the job, you understand. Things change, science changes, research to come up with different things. So why do you want us to stay 10 years in school just to come out?
Ajoshi says that doctors and nurses are bottom of the barrel quality. What do you make of it? What do you think about it? Is it true?
I don't know what to say because I don't know what experiences she has had that is influencing her to tweet a lot of these things. I feel like generally, it's not only in terms of this thing in particular she's talking about, but generally in life, no matter the amount of experiences you have, know that there are other people which may not fall in the same category. For example, you've had encounters with certain doctors, certain nurses that you felt were bottom barrel, right? It's not the same everywhere. You're saying people work just for some benefit. What did she say?
Enjoy public sector.
Enjoy public sector employment
And prestige.
and prestige. I mean, that was back then when you're a doctor, there's some whole prestige, there's some whole something that comes with it, but it's not the case currently, right? So I don't agree with her in that regard. And also with the part where she's talking about, what was the first you talking about?
Life expectancy.
The life expectancy. Life expectancy is not like the average number of years that you expect a person to live or something like that. So me, I'm not really a data person like Indemile was saying, oh, it's actually improving. I'm not that kind of person, so I can't really tell. But life expectancy is not only dependent on what happens in the hospital. It's not only dependent on what medicine has to offer. It's a whole lot of other issues. If you're looking at the definition, then a whole lot of other things accounts for it here, lifestyle, behaviors, and a whole lot of other things. So if you want to come well with facts, because you know a lot of people learn from Twitter. Some people are not all that there. Yeah, exactly. Like some people are seeing on the timeline, you're influencing certain people's perceptions and all of that. So before you come out with some information, then you should really educate yourself.
I think her experience, maybe seeing doctors like googling symptoms, makes it look as if you're supposed to know the things. Why are you referencing in my presence as a patient? That's how she has explained it, showing that they're clueless. I guess that's the correlation with the.
Okay, so would she rather die than for the doctor to confirm if what she says is
a
right?
doctor's Google search is not the same as
Yes.
a headache and
Yes,
diarrhea. And
yes.
I'm Googling
That's actually
diarrhea.
that's actually where I am coming from. One, would you rather, as a patient, die than a doctor to confirm, for example, what he wants to do?
I think she expects you to know. You are the doctor. So why do you have to visit Google?
No, there's no end to education.
Well,
There's no end to education. So like I'm saying, if I have a patient and the patient comes to me and the patient, whatever I'm trying to do for the patient, I feel like I need a refresh. Does that not make me a better doctor than to give or prescribe what I'm not so sure of because of a thing or two I've forgotten? I don't know the Dr. Crow question on the phone so who said the doctor was Googling something. And now unfortunately the medicine approach to patient care is such that everything is it's on a computer. So are you assuming that because I am on the computer it means I'm Googling your symptoms? For her to say that this one day, I think she's being naive.
She says that book smart and nerdy, but are they humane? That's what you should be caring about most. Do they have improvising skills, or do they just moan endlessly about lacking tools until you die? Like, you've gone to say that doctors are clueless, so they are referencing as they are consulting. Then you come and say that they are book smart and nerdy, but are they humane? Like,
so book my nerdy means you're being. Sorry, more being.
So I don't really know where she's getting at. Like, that's why this whole thread just confused.
Okay, I think that for the book smart and everything, there was a point where she said that we do chew and pour.
She said maybe overrated thanks to the massive PR around the chew and pour.
You see, one thing I believe about the education system is that just like you people were told in level 100 or 200, see, it will expose you if you are born. It will expose you. That's how the thing is.
You also mentioned that we don't know how to improvise, and something happened with her personal experience. This is personal experience. I'll put the video there for you to see what happened in the theater. Just because ECG decided to take the lights off, and in like 2 minutes, the hospital's generator wasn't back. Was it?
It wasn't just a one-time thing. Within the whole surgery, the lights went off like
3 times.
5 times maybe. It would go off for like 5 minutes. Come on, go off. Come on. It was very frustrating, and I mean, we need lights, but thankfully a lot of us, like medical students, were around, so then we used our phones to light up the field so that they could do the procedure well. So it really prolonged it. It's dangerous for the patients because you're exposing them, like, we're literally in the bone. Like, that's supposed to be a very sterile place, and you're exposing it so much. So if we were not there with our phones and flashlights, like, they couldn't have continued.
Yeah, I think it's very wrong for her to have said that, considering we are in Ghana. Everything is improvisation. So you see, aside the fact that we don't have the equipment, the patients also don't have the money. Do you understand? So it's a two-way thing. The hospital is struggling, the patient is also struggling. So you have to come to a compromise and still use your knowledge and all of that to arrive at a diagnosis and manage the patients properly. So it's very hurtful when people are doing the most and then you sit somewhere as a supposed data analyst and then you speak like that. Like, that is why she feels like people are attacking her with emotions, because it's actually painful. Like, and we're not even being paid well. No, you're not even being paid well. So, like, with all these things too, it's not like the pay is anything to write home about. So you should understand when people are speaking emotionally, because it's painful.
Making reference to Eskins to it's about the whole healthcare system, not just the emergency response system. I mean, we have an issue we have to tackle, but Nunya decided to actually target the healthcare professionals who are actually doing their best with the little resources they have. I think I just downloaded a picture from, this one is from Star FM, and they have a stat on the number of ICU beds we have. I mean, in the whole Ghana, we have 16 regions. So it says 10 out of the 16 regions in Ghana do not have beds in the intensive care units. Yes, 10 out of the 16. And the ICU beds for a population of 30 million plus, you're going to have a ratio of like 0.5 ICU beds per 100,000 people. And just imagine, we are in this system, and we have a doctor to patient ratio, which is not so encouraging because the number of people here, probably 1, because of Nunya's kind of statement, people are not really interested in medicine. Those also in medicine are doing their best, but we have to disperse them. Some have to go to the district. We don't get all of these people at the tertiary centers. So if you have doctors in the ICU and the beds are like 4 or 3 in a big region like maybe Greater Accra or maybe Central region, and you have 4 people, imagine there's a massive, accident or something that we need people. What you have to ration? What do you have to do? You see, this is a problem we have to be looking at. But Nunya decided to attack the healthcare professionals only. Fine, talking about chew and pour, talking about even what is enjoyment about the whole thing. I mean, fine, prestige in quote, there's a class that it places you, understand, when you're in the field. But what is enjoyment about the salary system and all that? I don't want to touch on that side because it will be as if I'm talking about money. I know I love money, yes, but this is something you have to look at. Resources coming, the system is working. then the people will do their best.
Yeah. So I was thinking about this. I think somewhere she was trying to mention about how good the systems are outside, or how good we become when we go outside. See, per experience and conversations with friends. You see, unlike our system here, I was talking to a colleague in the UK who tells me that once a patient comes and you start a conversation, you have an idea of what's happening. You you request all the labs that you need to request, and eventually, it gives you what you need. Imaging part. So if I have to do a CT scan for the patient, I do. I can do a whole body CT, a whole body MRI, and the whole imaging thing or the whole investigation thing tells me this is what the patient has. But the point is, in our system, after the patient has come and I think that this patient is having a particular thing, per my thought, I am expected, even from medical school, that this particular case, I should know about 10 differentials of this case in order for me to now try and ask for investigations that the patient can't even pay for to arrive at diagnosis. So in as much as her sentiment agreed, doctors in Ghana or this part of the world, I think you people do a lot. You do a lot of things by trying to apply yourself clinically. I mean clinical knowledge, and not just the MRI is doing the job for me, because we don't even have it. So we don't have an MRI that could help this diagnosis. We don't have a CT scan that will help this diagnosis. So me the doctor na and also me to me arrive at whatever is wrong with the patient. I wish you know how this is, or how difficult this is. But then we have come to love the job so much that the learning does not just end. They've come to love the job so much that the learning doesn't just end at or after medical school or during specialization.
I think that we have to give it up to Ghanaian doctors and African doctors. They are doing so well.
Yeah, let me quickly chip something there. The reason why she feels that, I think she said that when we travel outside, they become good because the system there puts them in place, or
Yeah, I think
something
you
like that.
mentioned about that.
That's not the reason. The reason is because it is so difficult to work in this our system that when you're able to evolve and get to that system, it becomes so easy. So it becomes very easy. So when you go outside, but the friend I was talking about said it. They do world rounds, they ask, take history, what's wrong? Then he says, and everybody's surprised. How can you just know that this is it? And he tells them where I am coming from.
We use our head. We use our head. We use our head, man, straight away. You have to just look at the
this other
symptoms.
section of the hair tweet or hair thread that I want to know from, especially the ladies here, if any of us have experienced that. She says that then there's the issue of male doctors sexually harassing female patients when they are alone with them in the consulting room. The next thing you know, a physician you trust is conducting an unwarranted vaginal examination because he can't control his horniness.
So to start with, I think generally her entire thread, I don't know whether she conducted any research prior to this thread. But then even if she did, I don't know what sample size she used, whether it was actually a true representation of all health workers in Ghana. Because let's not dispute the fact that maybe she's had certain experiences where she met bottom barrel doctors, where doctors were not putting in their best and things like that. But if you've met one or two doctors, how do you generalize it or even fence and say most doctors are this way? Do you understand? So if she's actually done a proper research, she has to let us know. Now to this topic of male doctors inserting their hands in vagina, do you know the number of vaginal examinations that doctors have done, and then the number of vaginas they've seen, and then you think your vagina is attractive or is going to satisfy someone, especially your vagina. Oh, I think I'm saying vagina too much. Someone else should come in and say something. Especially you with a condition that we are trying to find out, not even typically a healthy person. We are trying to diagnose something in you. So you, the person with a supposed defect or something that we are trying to find out, we are performing a vaginal examination on you, and you say that is the vagina going to satisfy someone's pleasure. I think that's off.
From the beginning of that tweet, she says when they are alone with the patients in the consulting room. I don't know of any, unless of course there are definitely exceptions, but how we are trained is that when you're performing such an examination, even a normal exam that you're not going there, you request for a chaperone because anything can happen, and even if you don't do something, you can be accused. So it's on the safe side for both the doctor and for the patient, a chaperone must be present. So if you are even anybody listening, the examination should be done with just you and the doctor, especially if they are of the opposite sex. And of course, it's something that has happened and will happen. Sexual harassment is unfortunately here, and it occurs in the medical field, and it has happened and it will happen that male doctors will abuse their position to harass certain patients. But how often is this? And does this apply in every setting? And to generalize every single male doctor for this is actually wrong.
I'm sorry, just to put it out there, she talked about health personnel in general, but we just seem to be talking about doctors because that is what we know more about. So we can't really say much for the nurses and then the other aspects.
Yeah. I don't think Nunya would have much of a problem if she could stop generalizing her experience.
Yeah.
You might have met maybe one bad doctor, but as Stacy said, a chaperone has to be present during a vaginal examination. So if there's no chaperone, let's take this probably to the whole public. Maybe you have to ask the doctor. So would you ask for anyone to be here with us? Like, you understand? Because if you are not feeling comfortable, you don't allow the doctor to go ahead. So I think sometimes our experiences might have influenced what she's saying, but you cannot just use one or two experience from people to just generalize that the whole health professional, healthcare, doctor staff is harassing and all that,
Okay, so I think apart from the whole generalization, just like Stacey said, for this one, I was going to side with you small because there's been issues in the country where doctors have to be jailed because of sexual harassment. So yeah, but you see, the thing is that let me say this. I think that she should better off come out with that particular experience that she has. That is no. If it is wrong, no. If it is wrong, it is wrong.
Someone actually
He's asking if you want to report someone. No, yes. If
there's no expiry date for crime.
yes, so if she feels that a doctor has harassed her and she has to come out, yes, we all agree. Don't you support that?
Oh, yeah.
Yes, we support it. You should come out. I think the law will take its course as far as that particular doctor is concerned, and then if the whatever is supposed to be done would be done. We will agree with that, and I don't think any doctor will stand anywhere to disagree with you if you are actually coming up with a report of sexual harassment. No one will actually disagree with that. But on the face of it, for you to just come out and say sexual, see, do you know the number of times when doctors will say, I won't look at it because I feel that your signs and symptoms are directive enough. A lot of times doctors jump the chance at looking at people's things.
And wait, although the bits of sexual harassment may actually be present, this issue too can be stemming from the fact that maybe it's all in your head. So before you go and meet a doctor or something who is going to examine you yourself, have a clear mind. Know that you are going so that they find out whatever is wrong with you. Because sometimes you are not used to it, and then take off your attire, take off your clothes, then already you are thinking, hey, then he's palpating or touching your abdomen. You're thinking, hey, why is he holding? Why is he, So such thoughts get into your head and then you think you are being harassed. But maybe that's not the case, even though there are some cases of sexual harassment.
Well, I think that I'm also thinking that for any VE that has to be done, there should be a reason, and I think doctors would inform you why they are coming to do it, and they are informing you because you have to know first of all, and they have to seek your consent. If you don't want that to be done, you are free to do so.
Anyway, I think that maybe this I'm sure they know that this should go out a little bit more. If this is what the populace think, that we take advantage of them, then I think maybe you doctors should also look at the bit of the consent part very well. I don't know, but for 400, 500, 600, the first thing you say when you are in any of the clinical examination is to, do I have your permission? So maybe we are not doing it enough, or because maybe because yes, maybe because we are.
When they finish, they say, "Mommy, that's all." Like they direct you. So there's that paternalistic nature of some doctors, and that's negative. Of course, not every doctor is perfect. You're not defending like because she said bottom barrel doctors, and every doctor is perfect. No. So that consent thing has to come out really clear. And you as a patient, that there's this thing, the patient's charter, and then the doctor's something. It's also charter. So it's like so the doctor has certain responsibilities, and you, the patient, in addition to your rights, you also have certain responsibilities. So if the doctor is not behaving in a certain way, you can point that out. You can tell them that, oh, do I need this examination? Like, can you explain to me why you need to do this? So that you deal with that condescending behavior from that doctor, because it's actually not permissive.
We are taught mostly about the, how do they call it? That consent is called what? Informed consent. Yes, the informed consent bit, which, but like I was trying to put on record that we doctors, maybe we should do a very good job at that too, making sure that we don't exhibit that paternalistic way of the
I think we have done our best with this whole situation.
Medical school Academy. You want to see the pictures?
Wait, this is very important. What is that part?
What is that part? I even quoted it.
Yes. Where is that part of the tweet?
It's here. Every year you see them on the timeline performing their ritual, posting pictures of themselves graduating from medical school. It's all fun and games until you're a patient on the receiving end of their education, motivation, and training. Awful is an understatement.
See,
Awful.
That's ritual. It is so important. That ritual. You have no idea.
This is the tweet that made me think she's coming from a place of hate, or she's being bitter about medical students and all of that. Because why would you simply hate on people post? I mean, it's not even just medical students. Everyone does. So why, if you are really concerned about the health system, how does this fit into the picture in any way, Nunya? And you see, I don't even think it's worth, like, she's worth talking about. In fact, this whole video, like, Nunya this, Nunya that, I think she's gotten so much hype that she doesn't even deserve. I feel like that is what she was looking for. Because someone tweeted that Bongo Ideas wishes that he made this tweet and and I really agree. I feel like it has given her some exposure now. When you say Nunya everywhere, everyone knows Nunya. Like, I was even thinking when I post my pictures, I should tag her or come and say something about Nunya. Man, I didn't struggle for 6 years to come and add it to my caption. So I'm not even doing that. I'm not even going to include her in anything. She's out of my life, out of my head. It's not my business. Whatever she wants to think is up to her.
So I don't know, for you to become a data analyst, it's just the way we university or whatever program you did. So is she telling us that when she went for her graduation, she didn't take any picture?
Even if she didn't, wasn't she happy to finish the school?
Yes.
That's how we express
Yes. No. I mean the expression cool, but is she telling us that she didn't take one picture? She didn't book photographer.
The only people who post pictures.
That's the point I'm going at. That if you took a picture, I am sure you may have shared it on your status or sent to family members or posted it on social media.
Yes.
So if you can do that, what stops the medical student who has become a medical doctor after 6 hard years to post? I mean, that is actually where I also felt the same thing like I just said. I think that, personally, I think that she's coming from a place where she's had a very bad encounter with the medical personnel, or maybe she's lost someone through the system and she's blaming the doctor for.
Blame the system.
No, but I'm trying to say that the system I use there mean that maybe she's brought a patient in the hospital and the patient has died, and she feels that the doctor should have done more, or this one day, for example, you think this patient has malaria, you come and then the patient dies. You start thinking that, but this patient, when I was coming with him or her, the patient was very fine, So how come she comes to lie here 6 hours or less and the patient is gone? Personally, that's where I think she's coming from. A place where she's had a very bad experience with the health system, and because of that, she's beginning to feel that it's the doctor's fault, which I totally disagree. But if that's where you're coming from, we understand her. It's hard. Like I said, my father's other brother died recently, and it's hard. But I'm not going to blame the CEO of the hospital for not buying enough ventilators or those things. We actually understand her sadness. But if that is the case, please come out and you should come out and blame your head on the fact that your patient or you've lost a dear one, but not because of the irresponsibility of doctors, I think.
Well, I would like Nunya as an able data scientist. I need her to give us a thread on the emergency response system in Ghana.
Oh, she won't. She said fuck the
data. But that's her field, so at least you should try and do that for us.
She said. She's not using any data.
Casey, final remarks.
Okay, so there was this video a very long time that Chimamanda made called "The Danger of a Single Story," and I think it applies here. It applies in everything, really. If you take one story out of context, or even within context of that story, it's quite dangerous if it doesn't apply to every single circumstance, and that's what's happening here. Everything that she said can actually be true in a certain context if worded differently and directed to specific
less
people.
emotions.
Yeah, if you're putting something out there to blame a whole field of professionals based on emotions, it's wrong. So before you talk, you have to know the danger of a single story because it doesn't apply to everyone. So the problem is really multi-sectorial. It's not, you can't say doctors are not doing enough. Doctors are doing too much for what they are paid for. So you really can't say that. So this discussion is this discussion is really broad. It involves a lot. So you just can't blame one.
All I have to say is that yes, she may have some points, but she should just not generalize her points. And we've heard her, and we will try our best. We learn from the bits that we have to. Yes, we've understood her, and then we'll better assistance.
Nina, I also want to tell you, if you see this, that just like you were asking for intellectual discourse on your thread, next time make sure that it is one, because you can't just come online and come and do hearsay, say your mind. No, if you data analyst, and most of the people that responded to you were either medical students, doctors, or people in the health professionals who are also very intelligent. So next time if you want to do something like this, bring facts, make it a fact-based thread so that people can respond factually. Now everything you've said, just like Ajua said, you've gotten the publicity and a whole lot, but it is too many hearsays, and I think, and it doesn't actually help you when you said that you wanted them to engage in intellectual discourse.
So as I said, doctors should try their best to memorize and to know every condition in the world. They shouldn't be referencing. I side with you on
well
this one.
score from your head.
I mean, all the scores, all the classifications, all the conversions, all the calculations. You don't even have to use calculator, please. I'm siding with you on this one. Yeah, but so no calculator. But it's not easy. The healthcare system should be the main target. So I will expect Nunya to not measure the minor in this case, you understand? Don't just pick out the healthcare professional and then, attack them in that context. But at least go to the system, list the problems we have. If you have solutions, put it out there. While the politicians may not see it, but someone interested might now carry it forward for some understanding to be done on that. So maybe.
Okay, so I think I side with almost what everyone has said here, and I also want to say that just like any other profession, you will definitely find a bad nut in any profession. So please, we are sorry you had to experience all that, or we are sorry people who are in your position also had to experience all that. And just as Ajua said, we've heard you. We will do our best as medical students, as nurses, as healthcare professionals, as doctors. We'll do our best. but please don't attack us or don't generalize your experience. Bring facts, because it hurts when you are putting in your all, but this is what someone out there is saying because of what she has experienced or because of what she has heard people say. So we'll do our best. Anyways, guys, thank you so much for watching this video. If you watched to this level, you've done so well. Thank you so much. If you liked this video, please smash the like button for me, and don't forget to subscribe. Tell a friend that we have posted a new video. So they should rush here and come and watch. Let us know what you think about any of our submissions in the comment section.
Bye.
See you in our next video.
Nice.